Hello my dear students. Today we will discuss about one important aspect in ICU setting managements, that is noradrenaline infusion, how to decide the dosage and how to fix the infusion rate. Commonly what we observe in ICU setups is often seniors or consultants will advise for inotropic supports, noradrenaline infusions, etc. in numerous patients. But when they advise it simply and go, juniors or house surgeons, interns, will suffer a lot when it comes to dose calculation. And majority of the times, they will be following some random numbers. So today, we will understand how to calculate noradrenaline dosage in case of ICU setups. So for that, what we will do is, we will deal this topic in these 5 segments mainly. First we will see what is the dose which is advised. Then some basics about the noradrenaline ampules. Then how to start and how to up titrate or how to titrate the dosage. And finally we will see some basics which everyone should know before considering noradrenaline. So when it comes to dosage, it is 5 to 30 microgram per minute is the advised dosage of noradrenaline. We will understand it slowly. Now we will see about the ampules. So you might have seen these noradrenaline ampules in your day-to-day practice. So here what we have to know is, each of these ampule, one ampule will have 2 ml of noradrenaline and it will be equivalent to 4 milligram of noradrenaline. So this is the basic which we should know about the ampules. Sometimes you might see one ampule only containing 4 ml of noradrenaline also, but the ideal one which we often use is 1 ampule is equal to 2 ml. Nothing to worry if it has 4 ml. The thing we have to remember here is each ml has double milligram. So if the ampule is 2 ml, there will be 4 milligram of noradrenaline. If the ampule is 4 ml, then there will be 8 milligram of noradrenaline in it. So this is the basic idea about ampule. Then we all know that we will use this ampule in 50 ml of syringe. So you might have seen this in ICUs. So usually we will use this 50 ml of syringe. So what is the importance now? Suppose we are adding 1 ampule in this 50 ml of syringe. So we are adding 1 ampule in 50 ml. So what will be the dilution quantity? So in 50 ml, 1 ampule in the sense 4 milligram, right? So each ml, like 1 ml, will have 80 microgram if you calculate. 80 microgram of noradrenaline. It is in 1 ml. If you have not understood this concept, I will further simplify it. See, we told that 50 ml of this syringe is mixed with 1 ampule, that is 4 milligram of noradrenaline. So how much will be there in 1 ml we want to know. This is a simple calculation. So 4 mg in the sense it is 4000 microgram, right? So milligram to microgram if we convert. So if we divide this 4000 by 50, it will be 80. So that's how we got 80 microgram in 1 ml of this admixture. So this is the ampule basics, right? So now what we will do? We will just start the infusion. So we know that. I will just erase it so that it will be clear. We got that 1 ampule is equal to 2 ml. 2 ml is equal to 4 mg. 4 mg noradrenaline. And we are mixing this 1 ampule in 50 ml of syringe, like 50 ml NS. That is giving us 80 microgram per milliliter per ml of mixture. Now we want to start the infusion, and we know that the initial dose is 5 microgram per minute. We have discussed it already here. So according to that, we want to start. But the thing is, whenever we are fixing the infusion pump, you might have all seen the infusion pump, right? So this is the infusion pump. So whenever we want to start this, we usually instruct it to be in ml per hour, right? Not in the minute. So for 1 hour, how much ml should be infused? That we will be giving the instructions. So here we know that it is in the minute range. So to convert it into hour, we just have to multiply it with 60, right? So 1 hour will have 60 minutes. So if we multiply by 60, it will be 300 microgram per hour. So this is the calculation. Hope you got the point. So the initial dose advised is 5 microgram per minute. We just want it in hour rate. So it is nothing but 300 microgram per hour. This is the rate we want to start initially, right? Now we know that 1 ml of this mixture will give 80 microgram, right? But we want 300. So what should be the ml here? It is nothing but, see, 80 microgram. If we want, it will be 1 ml. So if suppose we need 300 microgram, it will be, if we calculate, so it will be 3.75, right? 3.75 ml per hour. This is the initial infusion rate which we have to keep. Hope you got the point. So for 300 microgram per hour, that is 300 microgram if we need, we have to advise to infuse 3.75 ml of that admixture per hour. This is the rate we have to keep. Now how to up titrate it? So suppose the patient is requiring more dosage, that is we have started from 5, but we are up titrating it till 30. 30 in the sense 6 times of the initial dose we can give as maximum dose. So 6 times of this one will be how much? It will be 22.5 ml per hour. So this is the maximum dosage of noradrenaline which can be given to a patient. Hope you got the point. In the sense, slowly we have to up titrate it. For example, suppose it is 3.75, make it 4, 4.25, 4.5, like that we have to keep on increasing. But the maximum dose we have to know. This is all we are discussing when we are using 1 ampule, which has 4 mg only, right? So hope you got the point about how to start and how to titrate the things. Now I told that some basics we have to know regarding this initiation of noradrenaline infusion in patients. Commonly the thing is, in which patients we will utilize this? Mainly in septic shock, right? Septic shock. Why in septic shock? Because noradrenaline's mechanism of action is also important to know. Noradrenaline mainly acts on alpha-1 receptors. Its action on alpha-1 is very much compared to beta-1 receptors and negligible on beta-2. So this point, if we know, it will help in understanding why we initiate noradrenaline in septic shock. See, alpha-1 in the sense it will cause vasoconstriction. So mainly we are utilizing this drug for vasoconstriction. We know that in septic shock there will be distributary shock because of the vasodilatation. That's why the BP will be low. So what we are doing? Opposite of that, vasoconstriction, so that it will improve BP. If I ask you particularly what component of the BP exactly, it will be diastolic blood pressure, which will be increased to a greater extent. And second point, we told that it has action, moderate action on beta-1 receptors also. So we all know from the basics that stimulating beta-1 receptors will lead to good cardiac pumping. So this will definitely improve systolic blood pressure. So overall, it is improving systolic as well as diastolic. So the mean arterial pressure will be improved. That's what we require in case of septic shock. That is, all the tissues of our body and major organs has to receive adequate amount of blood supply both in systole as well as diastole. So the average is nothing but mean arterial pressure. So this is the basic idea of utilizing noradrenaline in case of septic shock. Hope you all got the point. Share it among all the medicine ICU residents, also among the house surgeons, so that it will be utilized in a better way for ICU care. See you in next video. But before that, just a small question for all of you. How to calculate mean arterial pressure and what is the recommended minimum level of mean arterial pressure in case of septic shock? So these are two questions if you have watched the video till end. If you are liking the content and if you find it helpful, please subscribe and support to us so that we can come up with such informative videos for you guys.